Hello Psychology, and welcome to your first video in this series on mental illness and the therapies to treat mental illness. This is a really important subject, and I'm hoping that in this intro you understand the perspectives of how the diseases that many people are struggling with and the diagnoses that many people receive, just what that means and what it implies, and how do people move forward and deal with these diagnoses. So let's go ahead and get started. An idea of just where we are in this country in regards to psychological disorders and mental health. If you look at these numbers, it's alarming. Approximately 1 in 5 adults in the United States, 43.8 million people, or roughly 18.5%, experience mental illness in any given year. This is a condition that substantially interferes with or limits one or more major life activities. And these are the numbers from the website NAMI, which I highly recommend you take some time, and you'll be given some time in class to actually explore. These disorders, while these are numbers that represent the United States, many disorders like depression and schizophrenia, these are diseases and disorders that exist in every culture in the world and in every country in the world. However, every country, every culture has their own perspective on how to approach the treatment for those diseases. So again, this is just setting the stage in terms of where we're going in our study of psychological disorders. So the word abnormal is often used to describe this branch of psychology, abnormal psychology. But what exactly does it mean to be abnormal? Why is it so important to define abnormal behavior? And the reality is, at some time or another, and some more than others, haven't we all behaved abnormally? And who says when our behavior is abnormal enough to present a danger to others and therefore requiring some type of detainment? So it's a term that is used to describe a lot of mental illness. But at what point does that behavior become abnormal enough? What are those degrees? This is where we're going. So in order to define psychological disorders, the American Psychiatric Association uses a book called the DSM-5, which I'll talk more about in detail later in this video. But they do have criteria that they use. And let me just go through this quickly. And these are not items and bullet points that you need to be writing down and getting down. I'm just setting the stage for you right now. So a behavior is disordered if you see a behavioral or psychological syndrome that occurs in an individual. It reflects an underlying psychobiological dysfunction. The consequences are significant and distressing. And it must not merely be an expected response to common stress. And primarily, it could be a result of social deviance or conflicts within society. Those are the general parameters of defining a psychological disorder. But again, we'll get into some more specific here. Those key words that you're going to hear, and I apologize for the graphics there, but the key word there is dysfunction, distress, and deviant. Those are words that we are going to refer to and use quite often as we study mental illness in this class. So let's focus now specifically, and let's kind of pare this down into some more simpler terms. A psychological disorder, what is it? Well, it needs to be what we would consider to be deviant. And if something is deviant, it's going against the norm of behavior. And that norm of behavior may be abnormal in one culture, but normal in another. And so it just depends on the cultural rules that are in place. The behavior is distressful. It can cause the person or others distress, and it disturbs them. The behavior is dysfunctional. It must cause dysfunction in the person's life. And by dysfunction, it means that it alters the daily life of the individual. The behavior is dangerous. It can cause harm to themselves or others. And the behavior could be unjustifiable or not reasonable. So it's possible that you could look at some of your behaviors and yes, you might be able to check off a box here. But what we're looking at are multiple explanations for a behavior. Saying that, a certain behavior is unjustifiable or not reasonable, that's going to happen quite a bit. And that doesn't necessarily mean that someone is suffering from a psychological disorder. You have to be able to check off multiple boxes here for it to be labeled a psychological disorder. So the little box there with ADHD or attention deficit hyperactivity disorder, I'm going to use this as an example here. Many people might not consider it to be a psychological disorder, and many, many years ago it wasn't considered a psychological disorder. There's definitely been some revamping of the book that we use to describe those disorders. But it is possible that ADHD is going to cause dysfunction in the individual's life. And very often, most typically, that would be in the lives of boys. There are more boys diagnosed with ADHD than there are girls. The behavior is causing distress to the person. It disturbs their normal functioning. Their behavior is deviant. It's going against the norm of behavior. There are certain rules that need to be followed in certain situations, and ADHD may prevent them from following those particular rules. And it is even possible at some points that their behavior could cause harm to others or to themselves because of the inability to control those behaviors. So just to give you perspective in terms of how you could look at a certain situation and apply the 4 Ds and the U to a psychological disorder. To look back, this gives us perspective in terms of where we are today. There were all kinds of ways and ways that the mentally ill were perceived and looked at, and how it was expected that treatment would be given. Things like trephination, exorcism. We know even more recently in the early progressive era in the 1800s, a woman by the name of Dorothea Dix was very aware that the mentally ill were very often, they were looked at as criminals and they were put in prison. And she was very involved in the reform of the treatment of the mentally ill. The picture that you see here in the skull, this is an example of trephination, where holes were actually drilled into the head. And the idea was that these evil forces that were possessing the individual could be released. So again, perspective of where we were and how far we have come. It has shifted into what we would consider to be a medical perspective. In the late 1700s and into the 1800s, we shifted into what we would call the medical model. And this is again where Dorothea Dix might come in, and her belief that you need to look at an individual's symptoms, and that the cure for their mental illness is going to come through therapy. And that may involve putting them in a hospital geared toward and focused on treating these individuals. So the medical model is a definite shift from how things were handled prior to this time. Most commonly in today's society, in terms of how we look at mental illness, we could use the label of biopsychosocial. It's a biopsychosocial approach. And what this does is it assumes that biological, sociocultural, and psychological factors combine and interact, producing what we would label as a psychological disorder. It's not just one thing. It is not just a biological influence. We can't just say that there is some type of chemical imbalance or something wrong with the brain structure. It typically will involve some type of psychological influence. Maybe there's been some sort of stress or trauma, or maybe the expectations on that individual from their family or from their culture combine to create the condition that they have and either lessen or increase some of the symptoms and issues and problems that they may experience. So let's break it down. We're going to backtrack a bit to the very beginning of the year when we were studying those beginning perspectives of psychology. And let's think how each of those perspectives would how they would look at mental illness. What is their perspective? How would they approach it? What is the cause of these mental illnesses based on the different approaches? So let's start with the psychoanalytic perspective. And you need to remember that those disorders, they will believe, come from some sort of unresolved childhood conflict, a repressed memory, something that has happened to the individual in their past. And so they very often might look at a person's early life history to see what their life experience has been and see if they can pinpoint an event in their early years. The behavioral theory, you got to remember some of those key words. They're going to look at things that have been a learned response, that your behavior is a learned response. And so to understand a disorder, they're going to analyze and look at how their behaviors have been learned and what type of reinforcement do they have in their lives that perpetuates or continues that behavior. The cognitive theory is going to center around what a person thinks and what a person believes, and those are going to contribute to their psychological problems. And the only way, according to the cognitive theory, that you can fix a behavior is you first have to change your thinking. The humanistic approach, I don't know, some people kind of call it the hippy-dippy approach. And this comes down to that individuals are responsible for their own behavior, and that includes abnormal behavior. There's a focus on the relationship between the individual and society and how they see their relationship to others. Disordered individuals very often are lacking self-worth. And that feeling then is going to result in maybe a deviant or abnormal illness or behavior. The sociocultural perspective believes that abnormal behavior is shaped primarily by your family, by society and culture, and those relationships can support and even cause abnormal behavior. And sometimes the stress that surrounds those relationships influences the disorders that these individuals may or may not have. So let's get into a really important component of that, and this is classifying these psychological disorders. There is a book that the American Psychiatric Association has compiled or rendered, and it's called the Diagnostic and Statistical Manual of Mental Disorders. You will never see the words Diagnostic and Statistical Manual. What is very commonly the title given, it's the DSM, and in this case it's the DSM-5, and it undergoes a revision every so often. I believe the last revision happened in maybe 2012, I want to say. So maybe about every 10 years there is a revision. But you can look at the evolution of this book and these psychological disorders. And when it was first created in the 1950s, there were 60 identified mental disorders. Whereas now in the current DSM-5, there are 400 psychological disorders. It has been an evolution of culture, of time and history. Things that were once seen as mental disorders are no longer considered mental disorders. And we might touch on some of those in class. But again, as we gain more knowledge of the mind and neuroscience, some of these disorders will continue, I believe, to grow and change and adapt. So we need to know how a mental illness is diagnosed. And in the DSM-5, the purpose of the DSM-5, it's going to give us these different categories. The DSM-5, if you were to look up a mental illness, it will give you information on the diagnosis, it'll describe the mental illness, it'll predict behaviors that might accompany that mental illness, it'll classify it. You know, is it a personality disorder? Is it a depressive disorder? So it'll classify it into a certain category. It'll also give potential treatments, and it will also give information about the causes of that mental illness. And you'll see as we learn more about some specific mental illness that you can predict causes of these. So this is the information that's included in the DSM-5. There's some overriding goals of the DSM or the DSM-5 currently. And you know, the overriding goals, they want to describe those disorders, and they also give perspective on how prevalent a disorder is. If there are 400 disorders, there are definitely going to be some disorders there that are not very often seen in the general public. However, because of research and case studies and studying human behavior, there are going to be things that have been identified that may not be super prevalent in the general population. These disorders are outlined by the DSM-5. They're reliable. This is kind of the Bible of psychiatry, and many professions, not just psychiatry, refer to the DSM-5. But what it does is it keeps everybody on the same page so that people don't use their own personal bias and belief and rely on bad information as we begin to learn more and more about mental illness. So there's some things that we need to be aware of when it comes to labeling psychological disorders. One thing is that the critics of the DSM-5, there's a lot of stigma that's attached to labeling somebody with a mental disorder, and that people place value judgments on an individual because they have been given that label. And I think we have come so far in the last 5 years in becoming more comfortable in talking about mental health issues and awareness, and the stigma that once was very prevalent is beginning to be lifted. And I think your generation are steps and leaps beyond where some of your parents and especially your grandparents, where the mindset might have been. Culturally, it might be a very different conversation. There is a piece of research that is really important, and this is one of those names you need to know in psychology. And the research was an experiment done by a psychologist by the name of Rosenhan. And his write-up about his research was titled Being Sane in Insane Places. And we're going to look at this in more detail in class when we meet. But what Rosenhan did was he gathered a group of individuals and gave them kind of a code word, which happened to be THUD, why this is also called the THUD experiment. And THUD was the word that they would report, these individuals, as they went to mental institutions to try to explain a problem that they weren't really experimenting. So they were pretending to have an issue. And what ended up happening was these individuals were admitted to the hospital because they faked these symptoms. Some individuals were there for a few weeks, some were there for months, undergoing medical treatment, medication, therapy, and they were diagnosed as having schizophrenia. And so it definitely shed a lot of light on ethics and labels and diagnosis. And again, this is a topic that we will go into in more detail in class together. The word insanity, if you write the word insanity, many people connect that word, and they will say that an individual is insane. Well, the term insanity is actually a legal term. And if someone is insane, they have been labeled that by a court of law. They've gone through the process, they've been analyzed, and the court of law has labeled them as insane. But it raises moral and ethical questions about how society treats these individuals who have these disorders. Is that a free pass? Is it okay, or does it excuse a person's behavior? People that have done horrendous things. The name Ted Kaczynski, who was known as the Unabomber, and you can look him up and read a little bit more on your own. Is that fair to be given the label of insanity and getting off from the crime that you have committed in horrible, horrible outcomes sometimes? The last point here is that labels can be helpful for healthcare professionals in communicating with one another and establishing therapy. It's important to have a basis and that everybody is talking the same language. And that's where these labels can actually be a positive thing. So these are the categories of psychological disorders that we are going to be learning about, and we'll combine many of these into different videos and lectures and information. But you can see these are the different categories and classifications that are found in the DSM-5, and that's how we'll try to approach them as we study some of these disorders in more detail in coming videos. I just want to finish this off with the prevalence of mental illness. And again, these are statistics that are taken from NAMI, and we will look at that. I'll refer it to you, or you can look on your own. And you can see the prevalence of just how significant the issue of mental illness is and why it is so important that we address it and understand it, both for you and your generation, and just in approaching the overall health and well-being of this country. So we have finished our intro, and I'm sure you have many questions. And I hope as we go through this unit, as you come up with questions, please, I encourage you to write them down, reach out to me, And we'll talk more about all of this when I see you in class.